From the Health Science Desk of the Boston Globe, I'm Stephen Smith, and this is Be Well, Boston. Hormone replacement therapy is back in the spotlight because of a new study looking at the use of estrogen only in certain women going through menopause. But what if women want to avoid medication altogether and look for alternatives to deal with the symptoms of menopause? Dr. Raj Krishnamurthy of BU in Boston Medical Center is here to explore the world of alternatives for menopause. So what are some of the ways women can deal with hot flashes and the other symptoms of menopause without resorting to hormones?
So there's a whole category of botanicals that have been looked at. There are things like black cohosh, which has been studied, and there's some studies that show some benefit and other studies that say it really doesn't make a difference, but I advise women to go ahead and try it. There's not any harm done, and if it helps your symptoms, great. And
so if you want to avoid taking any sort of medications, what do we know about things such as exercise, yoga, diet?
So there's not a huge amount of data on this, but what's certainly been shown to be useful is keeping your weight in a normal range. Exercise, yoga, meditation, all of those are good for keeping your weight normal. An adequate intake of calcium, about 1,200 to 1,500 milligrams a day, vitamin E, and all of those things have been shown to really be beneficial to women.
Now, there are going to be some women for whom none of these strategies is really going to provide much help, and they will need to have a discussion about hormones. When does a woman know that she needs to have that conversation with her physician?
Sure. So a conversation like that is really when the symptoms are so disturbing to you that you can't function. And about 50% of women going through menopause have some kind of hot flashes or mood, sleep, irritability type of symptoms. But again, about 15–20% have symptoms that are so severe it affects their functioning ability to manage their day-to-day lives, and that's a good time to talk to your doctor about what makes sense next.
Dr. Raj Krishnamurthy, thanks. And for continuing health news, stay with boston.com/health and the Daily Dose blog at boston.com/dailydose.